Hi, everybody. I'm John Milewski, the host of Dialogue, and I'm joining you from the set of Dialogue at the Woodrow Wilson International Center for Scholars. Just concluded a very interesting discussion on healthcare with our two guests. I'll introduce you to them and give you a little taste of what we've been talking about. Jim Landers joins us from the Dallas Morning News. And Jim, talk to us a bit about coverage of the healthcare reform debate so far. Be a media analyst for us, and how much good information are we getting?
There is a lot of good information out there, but this is also a process that's gone on for almost a year and a half. And so the analysis that was done of the bills when they first were presented had to be done over again and then over again and then over again. So a lot of people weren't really clued in until just at the last minute. And in the meantime, there was quite a formidable misinformation campaign underway that a lot of journalists had to spend time reacting to and trying to, give readers some better appreciation for what's really going on.
And you cover politics too, so you can't completely ignore the misinformation campaigns. You've got to cover it. Right?
Yeah.
Also joining us today is Marc Goldwein from the Committee for a Responsible Federal Budget. And Marc, what do we know with certainty as far as what has this nation achieved in its attempt to bring healthcare costs under control with this piece of legislation?
The problem is we know very little. The healthcare legislation has a lot of moving parts. It's very complex, added onto an already very complex system. On the one hand, we're expanding coverage, which will surely increase costs. On the other hand, there are a lot of reductions for Medicare and Medicaid spending and a lot of innovative improvements that at least try to take the first steps towards cost control. Whether they'll be effective is a question for another day.
For people out there who are interested to see if this is working or not, give us your sense of indicators they should be keeping an eye on. What are you going to be looking at?
Well, I'm most intrigued with the pilot programs that'll come further down the road here with reimbursements and so forth that are going to go on through the Center for Medicare and Medicaid Services. They now will have a lot more say over what payments hospitals and doctors are going to receive for their services. And the legislation is a lot more specific than it was in the past about those reimbursements. The medical community itself is already saying that they don't think these are going to be adequate and that they'll have to once again go back to shifting the cost that they don't recover from their Medicare patients to the private patients that are privately insured. But I think how that transference and that box of where, what happens to the money is going to be very interesting just from the regulation implications of this legislation.
Marc, I'm familiar enough with the committee's work to know that one of the constant drumbeats from your group is that this is about tough choices that need to be made. Take the temperature for us. 2010, Washington, D.C., how prepared are we to make tough choices?
Unfortunately, not very. We just came out of a very tough debate, and that debate was over expanding coverage, giving people something new. The next debate we're going to have is over raising taxes and cutting spending, and that's going to be a difficult one.
Well, gentlemen, thank you. And to those of you joining us via YouTube, I can't promise we'll answer all your questions, but you'll get a lot more from our guests in helping sort through this very complex issue. If you go to our website, www.wilsoncenter.org, look on the right-hand side of your screen and you'll see the Dialogue tab. You can tip there or click there, and then you can find the entire 30-minute interview. Hope you'll join us. Thanks.